I had days where I was literally sitting like this and I'm in tears. I just a little bit then.
Bob Alder has been a
Very emotional.
respiratory practitioner for 25 years. He says 3 months of work on the front lines of COVID-19 was emotional and exhausting.
You're up at 5:30 in the morning. You're in the hospital, in the critical care units till 7 at night. You get home, you eat, and then you got to do it all over again.
Alder says the staff at the hospital he joined was remarkable and became family.
It was the only people who welcomed you every day and appreciated you.
The long days weren't without reward. Alder says his first day, he met a woman who he calls Becky.
I was in the unit, I'm going to guess, for about an hour. And Becky started going bad, and she's on a ventilator.
Alder says she was approaching the point at which she would need CPR.
I said, give me an AMU bag, which is, I have to manually bag with 100% oxygen. So I pulled her off the ventilator. I bagged her for an hour and 20 minutes.
It became a team effort. Doctors, nurses, respiratory specialists, pushing meds for the heart, pumping oxygen, and communicating with each other about what was best for the patient. Organized chaos.
But an hour and 20 minutes later, we brought her back. And two months later, I saw her leave the hospital. And I can't even tell you how that makes you feel.
Alder says the majority of his patients were considered high risk, older people with pre-existing conditions. He says hospitals have learned better ways to treat patients with COVID-19, and because of that, they're having better outcomes. More people like Becky surviving and recovering. He says the most important thing now is for people to use common sense.
The most important thing that transmits disease are your hands. So I would tell everybody, wash your hands thoroughly, do the 20-second thing, make sure it's sterile. And if you're not feeling well, don't go to work.